to prevent liver damage. Why the liver? Why is it so important? It's the largest organ in the body. It carries out a variety of vital functions, most important being the metabolism of sugars, proteins, and fats, which it converts into energy. The liver also has a detoxification function. It filters drugs and other toxic substances. It has a synthetic function, producing bile, which aids in digestion, and synthesizes all the plasma proteins, including albumin and blood clotting factors. It has a storage function. It allows storage of vitamins, minerals, sugars, and fats, and therefore provides nutrition to the body. And in addition, it plays an important role in immunity against infections. With such an important organ, unfortunately, across the world, about 1.5 billion people suffer from chronic liver disease, with 2 million deaths attributable to it. In India, approximately 100,000 deaths are due to liver disease. It is important to remember that liver disease affects people regardless of age, sex, ethnic, or socioeconomic background. The other important thing is that chronic liver disease is often silent, and patients do not have symptoms and are diagnosed very late when it may be difficult to treat. It is therefore important to identify liver disease early by screening and to understand the etiology so that interventions can be carried out which prevent progression. And there are certain challenges to this. One is the stigma surrounding liver disease, especially when due to alcohol, obesity, or drug abuse. This creates barriers to early detection and care as patients do not come and visit the doctor. And in countries' national health plans and strategies, liver disease does not feature, except in India, which I'll be talking about. In addition, there is aggressive marketing of alcohol and unhealthy foods and drinks, and this is hard to combat, and this issue must be addressed. So it is important, and the European Association for the Study of Liver Disease recognized April 19th as the World Liver Day. But it was India which regularly celebrated the World Liver Day on April 19th from around 2018. It was in 2023 that several international liver organizations, including the EASL, that the European Association, the American Association for Study of Liver Disease, the AASLD, APASL, the Asia Pacific Association for Study of Liver, which includes India, and several other associations, thought they'd expand this to form an international movement aimed at increasing awareness on liver health. And they formed roughly a 3-year plan. In 2023, the focus was on raising public awareness about liver disease and breaking the associated stigma. This year, the focus is on promotion of prevention campaigns, educational programs, improvement of screening strategies, and increasing access to timely and effective treatment. In 2025, it is hoped that governance proposals will be put forward to tackle these issues in a concerted manner. The World Liver Day 2024 theme is therefore keep your liver healthy and disease-free. So before we know what to do to prevent, we need to know what are the common diseases affecting the liver. One common theme in all liver disease is hepatitis or inflammation of the liver. And this can be due to various causes, including the most common being viral, alcohol, metabolic, which includes the fatty liver disease, and drugs and toxins. So starting with viral hepatitis, I'm sure all of you are familiar with the viruses A, B, C, D, and E. Of these, A and E are waterborne through contaminated food and water, and they usually cause an acute hepatitis, which is self-limiting, and very rarely the damage may be severe. It may go on to acute liver disease. Otherwise, it's a very benign disease. Patients usually recover in 2 to 3 months. What we're interested in is in B, C, and D, which are blood-borne. And among these, D is always needs helper function of B. So we usually concentrate on the evaluation and management of B and C. When we say blood-borne, what do we mean? These routes of transmission are either vertical from the mother to the child at the time of delivery, sexual contact. Blood transfusion is much less common now because of stringent testing of blood in blood banks. Medical staff can get affected through needle prick. Drug abusers get affected through shared syringes, can also be transmitted through body piercing and tattooing with unsterile needles. And it's important to remember household contacts who share nails, scissors, razors, and toothbrushes can transmit the infection to each other. All the viruses can produce an acute hepatitis, which is usually characterized by a prodrome period where you can get nausea, loss of appetite, weakness and malaise, and low-grade fever, followed by the development of jaundice. This is usually self-limiting, as I said, in A and E, and they recover. But in B and C, it can go on to a chronic hepatitis, and further to cirrhosis, where patients may either be asymptomatic in the early stages or present with weakness, tiredness, darkening of skin, jaundice, leg swelling, abdominal distension, sometimes vomiting of blood and passage of dark stool. Sometimes they're present with encephalopathy characterized by altered behavior and drowsiness, can present with renal failure, decreased urine output, and they can develop hepatocellular carcinoma or liver cancer. So we have to treat at the stage before cirrhosis develops, where the arrow shows, at the stage of chronic hepatitis. So it's important to test early, but it may be difficult to screen the entire population. Whom do we screen? It's ideally all persons residing in areas with a prevalence greater than 2%. And we do have that prevalence for hepatitis B. We fall in the intermediate prevalence zone. Ideally, we should screen all patients, but at least we should screen patients with elevated liver enzymes, all pregnant women, so that we break the vertical transmission. We should test all infants born to HBsAg positive mothers, all patients who are exposed to blood products like hemodialysis patients undergoing transplants, all household contacts, and medical staff. And the treatment of hepatitis B and C includes antiviral medications, and these should be in select patients. With hepatitis B only, all patients need not be treated because the treatment should be continued indefinitely, because hepatitis B virus can only be suppressed with the present treatments. And all patients with HCV infection can be treated because the treatment duration is only finite, around 12 weeks, and you can get a complete response with clearance of the virus. Once cirrhosis develops, we only have to manage the complications, and in the end stage liver disease, liver transplant. The other important liver disease, which is gaining increasing importance now and is becoming one of the leading causes and may become the absolute leading cause for liver transplant, is non-alcoholic fatty liver disease, now better known as metabolic dysfunction-associated steatotic liver disease. Steatotic is to reduce the stigma associated with the word fatty, which many people don't like. And in order not to say non-alcoholic, in most cases, this is associated with metabolic dysfunction, hence the name change has been proposed. This affects an estimated 38% of the global adult population. In India, it's between 9 to 32%. And it's associated with lifestyle habits like high sugar, high fat food consumption, a sedentary lifestyle, and is often associated with obesity, diabetes, hypertension, and high cholesterol and triglyceride levels. It is usually diagnosed when there is more than 5% of the liver cells containing fat in the absence of alcohol intake, and is identified through abnormal LFT and an ultrasound showing fatty liver on routine examination. Fatty liver disease can also progress through the stage of hepatitis, fibrosis to cirrhosis, and to development of hepatocellular carcinoma. And effective management should be done again before fibrosis develops, and it includes weight loss, dietary modifications, and increased physical activity. There have not been very many drugs which have been responsible but useful in the management. But now we have, apart from vitamin E till now we have saroglitazar and the newly approved, FDA-approved drug called resmetirom. Next, we go on to alcoholic liver disease. The alcoholic liver disease-related cirrhosis again accounts for over 1 million deaths per year worldwide. The dangerous dose of alcohol to produce fatty liver is about 40 to 80 grams per day in men, but in women, much less alcoholic intake is needed to produce fatty liver. About 160 grams per day over 10 years may lead to hepatitis and cirrhosis. Again, alcoholic liver disease goes through the stage of fatty liver, inflammation, hepatitis, fibrosis, cirrhosis may be associated with hepatocellular carcinoma. Obesity, an unhealthy diet, and associated HCV infection can increase the risk of progression. Again, few treatment options are present. We have corticosteroids in severe alcoholic hepatitis and liver transplant. Hence, we need to address this very early on. A good chunk of liver disease can be caused by drugs and inadvertently through herbal medications. Medications can produce liver damage either if taken in large doses, as in paracetamol, deliberate overdose, or due to an allergic or idiosyncratic reaction, as in ATT, hormones, or antibiotics. Do not realize the large number of herbal supplements, including those used for bodybuilding, weight, immunity boosting. This was seen particularly during COVID, when a large number of people took what is called Giloy, and they developed acute liver failure with an autoimmune hepatitis-like picture. So it is important, and even green tea, when taken in large quantities, which people think is very good for health, can produce liver damage. So it is important to remember this and not to trust herbal supplements totally. So with this background, with this knowledge, what can you do to prevent or delay liver disease? As a person, as an individual, what can you do? You can eat healthy, avoid unsaturated fats, fried foods, fast foods, processed red meats, avoid refined sugars, avoid refined grains like maida, avoid sweetened drinks. Don't fructose in the sweetened drinks is very bad for the liver. And don't fall prey to advertising techniques which say unhealthy, no added sugar, because many of these contain other sugars which are equally bad. And what you should eat is fruits, vegetables, whole grains, nuts and seeds, beans and legumes. And when you use oils, mono and polyunsaturated fats are healthier options. Exercise regularly, preferably aerobic exercises, swimming, cycling, walking, yoga. Also, I saw a recent article where they say dancing is good. And at least 150 to 240 minutes per week of moderate intensity exercise is recommended. And even if that's not done, even 135 minutes per week, which translates to about 45 minutes 3 times a day, should be enough to reduce the progression of fatty liver. Strength training like weightlifting can be used to build up muscle. Avoid alcohol, especially if you already have fatty liver. No amount of alcohol can be considered safe. Be careful while dining out. This is for the foodborne infections. Avoid uncooked foods like salads, sauces, especially when you're not sure of the conditions in which you're eating. Make sure the drinking water is safe, either boiled, filtered, or from safe bottled mineral water. Avoid contaminated needles, practice safe sex. Visit your doctor regularly. This can be for screening purposes. Also, once you're diagnosed with liver disease, make sure you visit your doctor once in 6 months so that you can be screened regularly to detect progression early and to detect liver cancer early. Get vaccinated. And if you are positive for hepatitis B, make sure your family is vaccinated. Be compliant with your medications, not only antivirals, but if you have diabetes or high cholesterol levels or hypertension, make sure that this is under control, because this leads to better the reduction in the occurrence of fatty liver disease. So what can medical professionals do? So we should aim at encouraging health literacy and promoting behavioral changes in patients. So we should not just dash off prescriptions, but we should spend time talking to patients about lifestyle measures, what diet We should get very impatient when patients ask about their diets, but we should spend time to talk to them about healthy diet, about the exercise, what they should do. We can use social media to promote public awareness like we are doing now. We can participate in screening campaigns. We can network with NGOs as well as government organizations so that we can reach liver care to a large population. And we need government initiatives. India launched a national viral hepatitis program in 2018, and this is meant to improve vaccination strategies, screening strategies, and the aim is to eradicate hepatitis C by 2023. This still needs fine tuning, and we need better screening and immunization strategies. What we should be proud of is that we are the only country in the world we have here integrated fatty liver disease in national NCD, that is non-communicable disease prevention programs. This was done in 2021. The Ayushman Bharat programs, they aid these national programs and they encourage people, they provide medications and they encourage exercise and they give dietary advice to populations. But what we need for that is public health policies on alcohol. Maybe we can use measures should be used as taxation, price regulation, and advertising regulation. And we also need regulations on advertising fast foods, drinks, sweetened foods, especially when this is targeted with children, because we are seeing obesity at a very alarming pace occurring in children. So hopefully, in the next few years, we are able to have all these health policies so that we can reduce the occurrence of liver disease. So hopefully this combination of individual actions by the patient, by doctors, preventive interventions, and policy decisions on lifestyle measures can reduce the impact of liver disease globally. Thank you for your patient listening.
Thank you, ma'am, for this wonderful talk. This has enlightened us. Now, with your permission, can we take some questions from the audience?
Sure.
Okay. So, ma'am, we have a question that how can liver disease be prevented?
I'm sorry, how can liver disease?
Prevented. How can we prevent the liver disease then?
Yeah, which is what I said, by eating healthy, by getting screened regularly, by avoiding, washing your hands, avoiding contaminated food, have safe sex, avoiding intercourse, without the use of condoms, avoid use of unsterilized needles. While using tattooing, be sure that you do it in safe places. Universal vaccination, immunization programs, getting screened during pregnancy. These are all the preventive measures which I've mentioned.
The next question that we have is, what are the symptoms of a liver disease?
Okay, so very often liver disease is asymptomatic. Symptoms are sometimes just very fatigue. Chronic liver disease causes fatigue. And sometimes you may find jaundice. Other times you just have leg swelling. If you are getting, when you're traveling, you suddenly find your legs swelling. So many patients, when you ask, did you get leg swelling? They say only when we travel long distances. That should not occur. When that occurs, you should consult your doctor to see if you have. If any time you notice dark colored motion, black stool, it may mean that you're bleeding inside your gut. Or if you vomit and you have dark colored or you have red blood, it may mean you have internal bleeding, which may be caused by liver cirrhosis. Fever, weakness, loss of weight, sometimes darkening of the skin. Sudden darkening of the skin may be an indication of cirrhosis. Sometimes you find that especially if you have taken a sedative or if you have constipated for a long time, you may find that your speech is slurring, you're not sleeping, alteration of sleep rhythm. You're not sleeping at night, but you're sleeping in the daytime. This is an early indication of liver coma, very, very early stage, pre-coma. So if you have all these symptoms, you should consult your doctor early.
Thank you, ma'am. Thank you for this wonderful insight. So, on behalf of Nest 24/7, I thank Dr. Sarojini Parameswaran for this lively and informative talk. As you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctors and continue medications.
That's
With
right.
careful observation and precautions, it is possible to obtain control on the disease. I would also like to thank our audience for their active participation and patience in making this event successful. So stay connected with Nash 24/7 on Facebook and take care of yourself and your family members. Thank you.
Thank you.
Thank you, ma'am.